The following segment is sponsored by Providence Health and Services. This segment of AM Northwest is brought to you by Family Matters.
Health and education, safety, and the quality of life. KATU and our partners are proud to bring you Family Matters, offering solutions to the hard questions.
Because KATU and Providence Health and Services know that family matters.
You know, as we get older, it's important for our doctors to understand the health issues that older adults face. Here to share how Providence is helping ensure medical residents receive the right training, we welcome the Springs Living Regional Chair of Geriatric Medical Education, Dr. Laura Perry. Good to have you with us.
Thanks for having me.
So tell us about what you specialize in.
So I'm a geriatrician, which means that I specialize in older adults, like a pediatrician, but for the opposite end of life.
And why is medical training important for the residents?
Well, so residents have their medical license,
Right.
but they're still supervised for a couple of years while they're continuing to learn in practice. And I teach family medicine residents and internal medicine residents. Family medicine are learning across the life spectrum, and
Right.
internal medicine residents are learning for all adults.
But you're focusing on geriatric.
Right. So all of them need to learn how to care for older adults in particular.
Sure.
Older adults have had more opportunities for health problems to arise. And so the residents need to learn sort of what's different about an older adult versus a younger adult.
And so what will you be teaching them?
So I'll be using the American Geriatric Society's 5 M's of geriatric medicine. Mind, so what happens to our brains as we get older?
Oh, yeah.
What is dementia, and how do you take care of a person with it?
Right.
Mobility. Why is walking more difficult as we get older? Why do people fall, and what do you do about that? Medications. As we get older and have more health problems, we tend to be on more medications. How do those interact with each other? When do you stop a medication? 4 is multi-complexity. Like I mentioned, problems tend to add up. So when you have more than one health problem, how do these health problems interact with each other to create the entirety of the person's health? And 5th M is what matters most to the person. As you're thinking about all of these things for caring for a patient, you really need to put at the center what they care about and tailor their health plan to that what matters most to them.
Give me an example of someone you've worked with, an older person you've worked with, that what mattered to them. I'm trying to get an idea.
Sure. So for some people, what they care about the most is not living longer, but living better.
Okay.
Living free of pain. And some people will say, you know, it doesn't matter to me if I'm following the guidelines that are going to extend my life longer if I'm in constant pain all the time. I'd rather take fewer medications but focus on what's going to make me feel better.
Right. And then you have the residents do a clinical rotation in nursing homes.
I'm hoping to do that.
You're hoping to do that.
So right now I'm working on building partnerships to find some good places for them to have that learning experience. It's so common when an older person goes to the hospital to need care in a nursing home afterwards.
Right.
Often for a short period of time as they're undergoing rehabilitation from their illness to eventually get back home. But for the most part, doctors don't spend time working in nursing homes.
No.
So many of them don't really understand what can and can't happen there, and so might have an unrealistic expectation about what can happen after the hospital.
I feel like this would be a really important thing for the residents to do.
I completely agree.
Yeah, absolutely. And, okay, and then let's talk about what is accelerated aging.
Accelerated aging is a term that we use for someone who has a chronic health condition of some sort that makes their body change more rapidly than it otherwise would. Probably the best example of this is homelessness. So people who don't have a steady place to live age at a more rapid pace. So someone who is only chronologically in their 50s can seem biologically as if they're in their 70s, and that's how their body behaves. Other examples are chronic autoimmune diseases like rheumatoid arthritis or chronic infectious diseases like HIV. It changes parts of your body like your blood vessels in ways that would normally happen at a much slower rate.
Are you developing a curriculum then?
So yes, I'm adapting a curriculum that the American Geriatric Society has had, but making my own talks and using a combination of lectures, small group teaching, and then clinical teaching experiences to help all of the residents learn how to care for older adults in a way that's safe and compassionate.
Yeah, and then this would be at Providence hospitals and medical centers then?
It's a mix of different locations.
Okay.
Yes, a lot of time in the clinics, sometimes at Elder Place, which is an adult day health program, sometimes in patients' homes. So I've been taking some of the residents to visit their own patient doing a house call.
Yeah, I think this is a great idea. Thank you for the work you do. We want to tell everyone, if you would like to find out more about senior care and all the information at Providence Medical Group, give them a call at 503-582-2185 or go to KATU.com/Family Matters. Thanks, doctor.
Thank you.